Hello, this is Dr. Andrew Giacobbe, and I'd like to talk to you today about breast augmentation. Breast augmentation is my number one procedure. It's the most common procedure that I perform, and in fact, it's the most common cosmetic surgical procedure performed in the United States. So breast augmentation is a procedure whereby breast implants are used to enlarge a woman's small breasts or to restore fullness to a woman's breasts after perhaps childbirth or from weight loss. Breast augmentation can also be performed to even out uneven breasts. So for example, if one breast is larger than the other, we can put in a larger implant on the smaller side and a smaller implant on the larger side to even out the breasts. So I'd like to go over a number of the more common questions that I get asked in a consultation. And probably the most common question that I get asked is breast augmentation safe, and are implants safe? And so the answer to both questions is yes. The surgery is safe, the implants are safe. As with any surgical procedure, there are risks, and we do everything that we can to minimize risks. So for example, there are risks of bleeding and risk of infection. Fortunately, those risks are extremely low, and we take precautions. So in the case of bleeding, we tell our patients beforehand to avoid using aspirin or Motrin or Advil, or even vitamins like vitamin E, or supplements like omega-3s, or ginkgo, St. John's wort. We tell patients to hold off on those for 4 weeks before surgery, and that would significantly reduce the risk of bleeding. Risk of infection is extremely low, and we give antibiotics beforehand and also afterwards to minimize that risk. The implants themselves are very safe and very well tolerated. They are silicone shell implants, and the implants can be filled with either saline or silicone gel. And that is another common question that is asked, and that is, what are the types of implants that are used? So this is a saline implant. It has a silicone shell, and the implant is filled with saline solution. These implants were very popular in the 90s and early 2000s. But since 2006, when silicone gel implants came back on the market, silicone gel implants have become more and more popular, to the point now where, in my practice at least, silicone gel implants are probably 95 to 98% of the 95 to 98% of the patients will end up choosing silicone gel implants in my practice. There are different types of silicone gel material. So the silicone gel implants have a silicone shell, and then they're filled with a silicone gel material. And that gel material can vary in cohesivity or density, for lack of a better word. So the implants can be either less cohesive, or they can be more cohesive, or they can be very cohesive, quite cohesive. And these are the so-called gummy bear type implants. So again, an external silicone shell, and then an internal silicone gel material that, in the case of the gummy bear implant, is more dense. So this is a gummy bear implant that I have cut in half, and the shell has been cut, and then the material inside is this denser, thicker silicone gel material. Older silicone gel implants had a looser silicone material inside, more like a syrupy type substance. And if the shell were to break, that silicone gel could leak out. So with the gummy bear implants, this is considered an advantage to many patients, where even if the silicone shell were to rupture, the silicone gel material inside wouldn't leak out. that leads to another question, which is how long do implants last? And the rule of thumb is with saline implants, we say on average 10 years plus or minus. Saline implants could last longer than 10 years or could last less than 10 years. Silicone gel implants tend to last longer. We say on average 15 years, perhaps even longer. There's good evidence that with the gummy bear implants could last even longer, perhaps 20 years or more. But no implant will last a lifetime. It's important to know that. Implants are man-made devices, and they're not expected to last a lifetime. Another question that's frequently asked is, should the implants be round or shaped? We typically use round implants for almost all of our patients. This is what a shaped implant looks like. The implant has a permanent shape this way, a teardrop shape. The disadvantage with the shaped implant is that the shaped implant can rotate, and if it rotates, it could end up leaving a bulge in the wrong place. So we don't typically use shaped implants for routine breast augmentation. I typically use round implants for routine breast augmentation. And with the round implant, no matter how the implant rotates, it still has this natural teardrop shape. The advantage of the round implant with breast augmentation is that it does provide more fullness in the upper part of the breast, whereas with the shaped implant, you wouldn't get as much of that upper pole fullness. So again, an advantage of the round implant over the shaped implant. Another question that's frequently asked is, should the implants go above the muscle or below the muscle? And this is where the consultation and the physical exam is most helpful, because what we're looking for is how much natural breast tissue does the woman have on top of the muscle. And in patients that have a fair amount of their own breast tissue, if you were able to pinch in about an inch of breast tissue, about 2 centimeters of breast tissue above the muscle, in that situation, it's preferable to put the implants above the muscle. It gives a more natural shape and appearance, a little more fullness in the upper part of the breast, and a little better cleavage. The advantage also with an over-the-muscle surgery is that there tends to be a little bit less pain and perhaps a faster recovery. With implants under the muscle, I perform breast augmentation with implants under the muscle in women that have very little of their own natural breast tissue on top of the muscle. So in women that are very, very thin or have less than an inch of breast tissue on top of the muscle, it's preferable to put the implants under the muscle to avoid a very round and very unnatural shape. There is perhaps a little more discomfort with the surgery when it's performed under the muscle, but again, recovery is fairly rapid. So that leads to the next question, which is, what is recovery like? And for most patients can return to work in 2 to 3 days after the surgery, depending on the kind of work that you do. So for jobs that are not physically demanding, office type jobs perhaps, most patients can return to work in 2 or 3 days. With jobs that are more physically demanding, you may need to take a little more time off from work. In terms of exercise, we tell patients no exercise whatsoever for the first 2 weeks. That's very important. After 2 weeks, you can do some light exercise, perhaps a brisk walk or an exercise bike or an elliptical without using the arms. Anything that is more strenuous, you need to wait about 6 weeks. After 6 weeks, you can perform more strenuous exercise, aerobic activities, lifting weights, yoga, spinning classes, etc. Another question that is asked frequently is breastfeeding possible after breast augmentation? And the answer is absolutely yes. Breastfeeding is possible after breast augmentation. It's just that I can't guarantee it. In a woman that has never breastfed before, it's impossible to say if that woman is able to breastfeed either with or without implants. Women that have breastfed before, they should be able to breastfeed after breast augmentation. The implant, whether it's placed above the muscle or below the muscle, should not interfere at all with milk production and with breastfeeding. And then one other question that is asked frequently is mammography possible after breast augmentation? And once again, the answer is absolutely yes. And we do encourage women to go for their yearly mammograms if they are over the age of 40. You just need to let your mammographer know that you have breast implants, and they will take some extra time and do some extra views, perhaps sometimes supplement with ultrasound in order to do a thorough evaluation. But absolutely, mammography is possible and recommended on a yearly basis, once again, for women over the age of 40 after breast augmentation. So I hope that I was able to at least cover the majority of questions that you may have. Any other questions that you may have regarding breast augmentation, we would encourage you to call our office at 716-634-5555. You can email us at info@wnyplasticsurgery.com or go on our website, WNYplasticsurgery.com, and you can look at our extensive photo gallery and perhaps pick out a patient that is most similar to you in terms of body frame and breast size. And we find that to be very helpful with many of our patients. So once again, I hope that this was helpful to you, and any questions that you have, feel free to contact us. Thank you.